Hello, it's Dr. Maggie here. Today, I'm going to be talking about my own personal hormone story and what's brought me here, the things that have happened, my own hormonal story, my own hormone timeline. I want to share the details of that story, and I hope that it's going to resonate with you guys. And there's going to be a lot of details, some of it intimate. I can't wait to share it. All right, so we're going to go into my story. My story starts with mom. And really briefly is that my mom, in case you guys didn't know, she passed away 8 years ago from ALS, and that's Lou Gehrig's disease. And a lot of you guys don't know that. I think that's actually one of the toughest ways to die or to watch someone you love die. The story starts with my mom because when I look at my mom's being pregnant with me, she was 18 years old when she was pregnant with me. She had me at 19, and she was really underweight. I was a premature baby, which contributed to some of my hormone issues as well. But my mom, right after she had me, got pregnant with my sister 3 months later. And she was severely underweight. She was anemic, and she was also had a lot of bleeding. And when looking back, I realized that the signs that she had Hashimoto's started at her postpartum period with me. And when she got pregnant with my sister, she nearly died. And they almost said, either you have to abort this baby or your life could be at risk because she was so underweight. And during my entirety of my sister's pregnancy, my mom was on antibiotics, like a lot of it. I mean, she was actually at the Chinese medicine doctor getting her pulse taken because she was so ill once she found out she was pregnant with my sister. So this postpartum period for my mom was really a vulnerable time for her. And because that was a big shift of a hormone downshift. And interestingly, my sister and I, as children, started to display some chronic health symptoms, starting with constipation. And my sister,
And you're young. Like, how old are you at this point?
my earliest memory is probably like when I was 4, maybe my sister was 2 or 3. And some of my earliest memories of my sister was, my sister Lisa's going to kill me for this. But sit on the toilet back to back, and we would have our feet swinging for an hour, probably almost every single day because we were so constipated, right? And we'll just sit there and be singing and chatting and stuff, but like we were just like, I think it was like, wow. And I realize now that the fact that my mom was so sick during pregnancy with me, and during my sister's pregnancy, she was on antibiotics the whole time. So, and my mom displayed early signs of Hashimoto's, even postpartum with me, autoimmune, but it was triggered by the delivery of the baby, me, and delivery of the placenta, which is a hormone making organ, that really triggered it for her. And as a result, it was like, she had an autoimmune issue, she had hormone imbalance issue, and my sister already started right off the gate with chronic constipation, which we will later learn ties into a lot of my hormone imbalances and hers.
Yeah.
So I remember even tracking back there, chronic constipation was my symptom until I was in my late 30s, just so you guys know. And when you don't poop every day, people, you cannot balance your hormones, because one of the keys to hormone balance is pooping every day, right? And you could already see that chronic antibiotic use during my mom's pregnancy really set up my sister's the baby's gut microbiome to be deficient in a lot of these really beneficial bacteria, which contribute to her symptoms. And I later learned that food intolerance and food sensitivities had a lot to do with why I was constipated throughout most of my life. And then, so what happened was, when I went to college, I had a couple of things. Is I started getting recurrent urinary tract infections and recurrent yeast infections over and over and over again. This is when yeast medication wasn't over the counter, and I had to go into the doctor every single time. And I had no idea that my diet at that time, alcohol use at that time in college and all that stuff was really creating a hormonal shit show in a lot of ways that's like changed the bacteria in my gut that caused me to have recurrent infections over and over again, whether that be urinary tract infections or vaginal yeast infections. I didn't know then, but I know now, and how many of you does this resonate with, had recurrent infections, one type or another, and you didn't even realize it was related to big hormonal shifts.
I dealt with it. I know. And yeah, you're not tying that into, I better change this about my lifestyle to stop having that happen.
Absolutely. And so that was college. And then I got married and I had my first child. And man, was it not what I thought it was going to be. Here I am. I was already a physician, And I thought I've delivered over 100 babies at that time. And I thought, I got this. I got this. Oh my God, you just not get it. I have delivered 100 babies, so I got this. Wrong. Okay. I had no idea what what being pregnant and delivering a baby would do to my body at all. Because during the pregnancy with my son, I pretty quickly my blood sugars went out of control, and I was diagnosed with having gestational diabetes. I was like, me? I never had a blood sugar problem. All this and who, me? What does blood sugar have to do with it? I had no idea that gestational diabetes or diabetes were even autoimmune diseases. And even right now, none of the physicians you're working with even think about them as autoimmune diseases. So there was this huge thing that was already telling me your insulin is really jacked up, and insulin's a freaking hormone. So you've got hormone problems, girl. No idea. And so I had gestational diabetes during the pregnancy. And I'm just going to say I was not in the healthiest relationship. I realized I was not in a healthy, safe relationship.
What does that do to your physical health if your emotional health is struggling so badly?
Yeah. I had a conversation today with my partner, and I was just talking about what it felt like to go through. Like, we have an identity. I have an identity. Like, I have an identity as mom. I have an identity as wife that is, like, for me, important. And I was just thinking about how I was telling him that today that I felt really fucked over and screwed over, never having the opportunity to live my identity as being like the best wife and partner because I wasn't in healthy relationships, and how disappointing and sad and shameful I felt about it. And so many of us have identities that are important to us. That's a part of who we are, but yet life circumstances prevented us from actually living the fullness of being the queen that you are, of being the wife that you are, being the mother that you are. I was screwed on so many aspects of it because I did not choose wisely. Like a lot of people, like, I think who you choose as a spouse and who you choose to stay in long-term relationships with is really critical to your mental health, to your identity, and to your physical health. And I can say I'm going to take responsibility and say I didn't choose wisely what was right for me. I didn't participate in the healthiest relationship that allowed me to live my full identity as the wife and mother, friend, that I could have, that I am. That's where I was sick and I realized, and I want to tell people this.
Yeah.
This is why I got sick, not only with hormone imbalances, being constipated with all that resentment, disappointment, and shame. And I think also ultimately that's why I ended up having autoimmune disease, because it's autoimmune. Your immune system is supposed to protect you, it's supposed to love you, it's supposed to be your nurturing mother, it's supposed to kill shit and germs that's coming to attack you. But instead, my immune system was trying to kill, attack, and punish myself. And it's because of being in those kinds of relationships for 18, 20 some odd years of my life that caused me to be ill. And that is a huge part of why I think my hormones were jacked up, is that unhealthy relationships and people who take from you, and also feeling like you're the kind of person that's just there to please other people, caused me to literally be a bottomless, empty bowl that just got sicker and sicker and sicker. I was not in a healthy relationship when I was pregnant with my son. And as a result, when I had him, I went into the worst postpartum depression, the worst depressive episode of my life. Up to that point, I lost hair. I couldn't lose weight. I ended up getting a breast infection. Infection is a recurring theme, people. I got a breast mastitis infection. He wouldn't breastfeed. I was pumping milk every 3 hours, and he wouldn't breastfeed. Just kept screaming every time he saw my breasts, and it was like rejection. And I ended up getting antibiotics for the mastitis, which then killed all my good gut bacteria and ended up getting what's called C. diff infection. And C. diff infection is a resistant bacteria to the antibiotic. And it's really difficult to get rid of because it got there because the antibiotics killed all the other guys. So I had it for 18 months. And that on my gut really caused me not to, and I've talked about this, fermentation and defecation is the final step of hormone breakdown. Now instead of having constipation, I was having diarrhea, mucousy diarrhea, TMI. I'm sorry, I'm not, because I want to be real and honest here. So for 18 months, every time I thought I was passing gas, I was having diarrhea. And imagine as a doctor, young doctor, running to the bathroom, trying to help other people. But I was running to the bathroom. Oh, I got gas. I better go to the bathroom because I don't want an accident. And it was because I had this C. diff infection that antibiotics could not treat. I was on 6 rounds of antibiotics that it wouldn't clear. And that was 18 months of it. And so that played a huge part in causing my hormones postpartum. My hormones crashed. And then I had severe diarrhea and my bacteria dysbiosis. Dysbiosis means like good and bad bacteria mix is really off. And so that prevented my hormones from getting balanced even more. There were barriers with infection, with hormonally, with delivering a baby and trying to breastfeed and pump milk, also being in an unhealthy relationship. That really caused me to really physically have a shutdown. And I ended up, making a decision to move from LA to Portland, Oregon, disconnecting myself from, at the time, some unhealthy relationships. And so I ended up moving to Portland, and ended up working as a family practitioner I worked for Kaiser in LA. And then when I got here to Portland, Oregon, I ended up working for one of the largest medical groups that are here. Ended up as a really successful family practitioner, ended up being medical director of that clinic. And as that was happening, I had my second child, my daughter, Emma. And again, still in the same relationship. That was not healthy for me. And so here's the thing. Before I even found out I was pregnant, this is like going back to almost deja vu with my mom's story. So before I even found out I was pregnant, I had a really bad shoulder pain in my right shoulder. It felt like a couple of weeks. That was like terrible and severe. No idea why. And I ended up going to one of my doctors, and they gave me a steroid injection, right? And immediately when I got the steroid injection, I started to feel really thirsty, dizzy, and all this. I checked my blood sugar because I was in a clinic, and I checked blood work, and my blood sugar was like almost 400 or 500.
Wow.
That's how I found out I was pregnant with my second child.
Oh my goodness. Okay.
was because I was like, what the hell? How did I suddenly have blood sugars of like a diabetic? Oh shit, am I pregnant again? Did a pregnancy test. I was pregnant with my second child. And this was 2 days after I had a steroid injection. I was like, shit, I just had a steroid injection. Now I'm pregnant. And my blood sugar's through the roof. I immediately saw a neonatal doctor, a specialist for high-risk OBGYN. And he's like, you got to get on insulin like today, Maggie. And so I became an insulin-dependent gestational diabetic. The second pregnancy, which is already a sign that this was a hormonal shit show, everybody. And there's something more to this. And at that time, I didn't know that diabetes or gestational diabetes is even an autoimmune process or a hormone process. Doctors aren't trained to think that way. So I was on insulin during the entire pregnancy with her. I delivered her, and postpartum was when all hell went loose with my health and with my life. Yeah.
It's interesting to me too. You bring up a good point. It's like you're a physician, but you're not connecting these dots because it's just not what you're trained to even think about.
Absolutely. And so I had used insulin during the pregnancy, controlled my blood sugars, and I delivered Emma. And when I delivered Emma, I was the opposite, where my son, and I didn't even go back to it, but my son ended up a year later having some vaccine reactions. And when he was 3 to 4, when he was 5, maybe 6, he was diagnosed with autism spectrum. So these are also clues that there's some chronic health issues going on with mom that needed to be addressed prior to him being born, maybe. Knock, knock, side signs. But when my daughter was born, I had, again, postpartum depression and severe anxiety so bad. And I was diagnosed with having severe pain with fibromyalgia. And this is when the pain really came on. The worst part of this was the brain fog. How many of you guys have brain fog up there?
Yes.
Right. And I'm sitting here in a clinic as a family practitioner, top functioning, grossing, rated family medicine doc of this huge medical group, 300 physicians. I'm medical director. And then I have severe brain fog postpartum. And I started to really F up my job with the anxiety, with the depression, with the pain. I was told that, I should go on birth control pills. I was supposed to go on Prozac, which I did. I was supposed to go on gabapentin Neurontin medication for the pain, which I did. But things got worse to the point where I lost my job.
Talk to me about what was happening at work. I mean, the brain fog was getting so bad that what was going on?
The brain fog was going really bad. The anxiety level was all fever pitch. I was in individual therapy, marital therapy, in an unhealthy relationship. And I wasn't making good decisions at work. So think about identity. I was a leader. I was the medical director of a clinic. I was supposed to be the one that people come to for answers for their health. And here I was, sick as a dog, working like a dog and trying to hold it all together. And my life was completely falling apart once I had my second child with that postpartum hormone drop.
Sounds like your marriage is crumbling, your health is crumbling, your work is crumbling. What kind of mental place are you at that point then?
I lost my job. I lost financial stability at that time, and I went through a divorce at that time, and I lost my family. Like literally, like it was not a easy, divorce, and access to my kids, all this stuff was like everything was like, and it was like I felt like, I mean, if there was a point in my life, there was a point, but if there was multiple in their life when someone wanted to end their life, that would be definitely one of them. Believe it or not, the point of that story is postpartum drop in hormones triggered a lot of this health shitstorm along with life happening to culminate in all was lost. And during that all was lost, I remember like I was on my knees and I got on my knees and I actually like could not figure out how humanly possible I could solve this problem. Because I've never been in my life like with that many things crashing down, right? And so I couldn't see a human solution out of it. I literally kneeled down, got on my knees and said, God, if there is a way out of this, I need you to show me. I need you to show me. And the very next day, I don't know how, but it came to me that you needed to open up your own clinic. I was passing by a building that was like 2 blocks from my previous group practice, and it said vacant. I called and happened to get the landlord, and literally about 48 hours after that, we met in the vacant building and we shook hands on the deal, and I started my practice. First time my private practice. And the interesting thing that I didn't get to in that story was that right around this time, I went through early menopause.
And remind us your age here. You're in your mid-30s.
I was about 35, 36 at that time. And the part that I missed was that after I gave birth to my daughter, all that shit show happened. I gave birth to her at 33. And it was about 35 that my periods stopped coming. And it was about 36 when periods completely stopped for a year. And I went to my OBGYN and I was like, why haven't I had my period for a year? I need my hormones checked, all this stuff. And he's like, if you're menstruating, then your hormones are normal. If you're not menstruating, it just means that we don't need to check it. It just means that your hormones, you're not making any more hormones. Let's do one lab test. Let's do an FSH. I go, okay. We checked an FSH, which showed me I was in menopause, like meaning no hormones. My ovaries shut down and no hormones. And so the answer was, Maggie, you're in early menopause. And I was like, okay, but why? And it's like, well, you're probably just getting older. And I was like, I'm 36, I'm not 86. And this is one of my colleagues. And that's when I started to realize I had to ask deeper questions. And it was right around that time, another divine intervention was that Suzanne Summers was on Oprah and talking about like bioidentical hormones and all this stuff. And we had no training as doctors around this, and we thought she was crazy. There was even a Times cover at that time about how Oprah was crazy for bringing up bioidentical hormones. I remember something like that. And I had a patient, Geraldine was her name, brought me a book and said, hey, I think there's something about bioidentical hormones that I don't have any physicians that I can look at in Portland, Oregon that understands anything about this. Do you mind just reading this book? Because I thought it was really great. And I read a book by Nisha Jackson, and it made complete scientific sense to me why hormone balance was important. And the book was around how to prescribe bioidentical hormones to meet the unmet need of these hormones. So I started, there were no resources for a medical doctor to learn about this. There was no money in teaching doctors how to promote this because nobody makes money out of hormone therapy at that time. And so I took it upon myself. I called local compounding pharmacies. I looked at naturopathic conferences and I decided it made total sense. I started to learn through Geraldine and other patients. And I started saying, yeah, instead of these prescriptions of these hormones, why don't I start compounding these hormones for you? And they got better and I got better. And I started getting known as a bioidentical hormone expert. One of the only MDs back then that in Portland, Oregon, that did any compounding of hormones or prescribing for bioidentical hormones. And my practice went insane. My own practice was a family medicine practice clinic when I first started it, but it got bazillion filled with patients wanting bioidentical hormone therapy. And so I started to prescribe bioidentical hormone therapy. But what I realized, here's the big aha: hormone replacement therapy doesn't mean hormone balance.
No.
And I realized that many people temporarily got better, but oftentimes, because the underlying issue that causes the hormones to change didn't change, it would be back and forth, this revolving door of them coming for visits, paying for visits, coming for visits to adjust hormones. It was like this roller coaster ride that people are on, or the hormones help but didn't help long run, or it can trigger sometimes even worse symptoms. And so there was definitely a huge population where just giving bioidentical hormone replacement didn't help them, and in fact could make them worse, or we were constantly dose adjusting and they weren't better. And so I started to recognize there were other components besides just giving people hormones that was even more important. And that's when I was also learning a lot about naturopathic medicine. The clinic started to evolve where it became the biggest integrative clinic, grew from one doctor, me, to 8 providers, half of them being naturopaths, half of them being primary care doctors. And we started to incorporate all these other pieces that was affecting people's hormones, or the hormones were affecting it. We started really educating ourselves with naturopathic medical director in our clinic, and we became literally our own university with naturopaths. We're having naturopathic medical director who was really great on education, educating all the primary care clinicians. All the primary care clinicians were educating them. I was educating them on all the medical aspects that was missing from naturopathic training. And we were the first huge integrated clinic in Portland, Oregon. And that was about 8 to 10 years of this. And this is when I recognized in myself that there were a lot of people with underlying chronic inflammatory conditions, autoimmune disease, chronic disease, that was the underlying cause of these hormone challenges. And vice versa, the hormone imbalances was triggering those symptoms.
You had so much real life experience of working with all of these patients and seeing for years and years, okay, this person responds well to this, but that person isn't responding well to this. Why is that? So many years of experience, real hands-on experience learning. And this was kind of the start then.
I got to think outside the box. I started to realize that there were all these other components that were going into hormone balancing, and that there is a total difference between hormone balancing and just hormone replacement therapy. I could no longer just say I'm a hormone replacement therapy expert, which I was. I was interested in something way bigger, because if people didn't get the ultimate outcome, which is health transformation, because I gave them hormones, well, then what is?
Mm-hmm.
What is? It's not that hormones were important. It's that hormone replacement therapy didn't mean hormone balance. And as a result, they didn't have hormone balance. And it triggered all these other chronic health symptoms that they had, or they didn't get better, or they got worse.
And so people want to know, Dr. Maggie, how was it that you were able to trailblaze this then? Because there couldn't have been very many people to learn from.
So in the clinic, I was developing a reputation not just as a hormone replacement therapy expert. I started to really look at what are the underlying causes: food sensitivity, autoimmunity, digestion, vitamin deficiencies, thyroid, blood sugar. I started to really see that those were like ding, 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 and people started to get better. So I developed a reputation for being able to deal with impossible to deal with health problems and getting outcomes that they couldn't get anywhere else. So people reached out from me from across the country to work with me. So I had clients all over the country, even as a clinic in Portland, Oregon. And that was the beginning of me. I was in the clinic and I did this 30 days of Facebook Live. And I realized that I wanted to create an online platform where I was able to provide the education that they needed. That wasn't just me trying to one-on-one on like a 15, 20-minute visit trying to deal with. I was like, how can I package this in a way so that every single person that I work with is going to learn these things, get these testing, interact with me, and, all that in a way. So that's when I started an online program. It was 6.5 years ago. Nobody else was doing that. No doctor was doing, what can we do with an online educational program that provided not just that provided education to teach people how to order testing, how to understand our results, how to troubleshoot and learn at a master level. Like, I'm serious. Alumni who have been in our programs, just talk about the hormone section of our program, what that's like. As far as the content that's in there, first of all, you will never get that content anywhere else. And the reason is because so much of what I teach, nobody else is teaching, because I think it's a culmination of the life experience. Watching my mom's generation go through what they did, my own life experience, my own experience going to early menopause, my own experience with these diagnoses, and then understanding the role of chronic disease like autoimmunity in my own life. And then adding all the additional training I had in naturopathic and functional medicine, and then getting to practice that over a 27-year medical career is why I've been able to put this into a teaching educational program. And I just don't see anyone else being able to provide that for people. And I love being able to think outside the box and say, I laugh at danger. It's not even dangerous to me. I can solve that problem. I can see the patterns they can't see, and I can't freaking wait to solve it. It took me 23 years to get here. So how can I compress that time so you don't have to spend 23 years to get here? And how valuable is that? Why don't I take the $1 million investment that I have put into my own education, my own medical care, and all the lost income I had, including a year and a half, 2 years of being this, like, pretty much practically disabled and having to hire another doctor to be my hands. We didn't have scribes at that time. I had to hire another doctor full time to come in with me to the exam rooms because I was that sick.
Well, and that had to hurt, your pride as well. You're not able to function enough to do it yourself. You're having to hire somebody to come with you.
That's what chronic pain, chronic anxiety, autoimmune disease, imbalanced hormones, and a toxic relationship will do to you. And it's not because I'm a dumb person. It's because I was a really smart person who had really some medical problems that the conventional medical system didn't know how to solve because they couldn't think outside the box. So I had to do it. And that's why for me, like, I don't want another Maggie out there. I don't want somebody to take 26 years to get there. To think my kids could have been without the mom that they have now. To think I wasn't even, like, because of the circumstance that prevented me from being the mother I dreamed I knew I was. I thought, like, my life wasn't worth living. This is what drives me. And I know what you guys have seen up to this point, and I was looking forward to being able to share this story with you guys because I want you to really, like, that is me, right? That's putting out teaching and education and all that. But I want you to understand what drives me, what brings me joy, what's my passion. I don't want another freaking old Maggie here for any of you. And I want to take all the opportunities that I was gifted. I'm so thankful that, believe it or not, that my mom got sick. I'm so thankful. Why? Because it gave me an opportunity to, like, fight for life. I'm so thankful that I got to hit rock bottom multiple times because now I value my life and I fight for not just my life, but anybody out there who feels like that the world or your medical challenge just cannot be overcome. I call bullshit. There's no way, no how, not on your watch, not on my watch, that's the case and that's true. It's not true. I think one of the most important things that I want to point out to you guys is that there is a hormone story in this health. And I had a hormonal timeline, which means that there were certain times in my life where I was hormonally shifting big time, whether it's down or up, right? That triggered the onset of these other health problems. And one thing that I would like you guys to think about is if there's anything, start now thinking about your own health, right? Major times when you had a health crisis, mental health crisis, whatever it is, think about, was it triggered by a major change in your hormones? And this isn't just applied to women, men, right? Why is it that around, puberty is a big time for men to have some triggering of their health problems? Why is it around the 30s to 50s? There's such a thing as, men can really experience new onset of symptoms, right? I think my own experience and the unique circumstances of the training and the wisdom that I've gained along the way, along with the personal growth work that I've done and the healing that I've done myself, that I've been able to do this. So I love being in a situation and unique opportunity to say, it doesn't even matter to me what the health issue is. I can help you 100%. So thank you for joining us. And I would say that if there's anybody that you think that you want to share the story with after you've listened to it, I would love for you guys to raise awareness around some of the hormonal impact, what hormonally volatile times are, and then in your life thinking about what is my own hormonal timeline and how did hormones play into this. If you want to book a chat with our team, we're going to put a link in chat for you guys to directly just apply. Just go to that page to pick a time for a short chat with our team. So we learn a few things about you so that we're able to have a good conversation about what is the right program